1. Which of the following best describes the primary role of a certified diabetes care and education specialist, CDCES? A. Prescribing insulin and oral medications. B. Providing comprehensive diabetes self-management education and support. C. Performing surgical interventions for diabetes complications. D. Conducting laboratory testing for diabetes diagnosis. 2. According to the American Diabetes Association, ADA, what is the recommended target for HbA1c in most non-pregnant adults with diabetes? A. Less than 6.0%. B. Less than 6.5%. C. Less than 7.0%. D. Less than 8.0%. 3. Which of the following is the most appropriate carbohydrate recommendation for treating mild hypoglycemia, blood glucose less than 70 milligrams decimal? A. 5 grams of carbohydrate. B. 15 grams of carbohydrate. C. 25 grams of carbohydrate. D. 50 grams of carbohydrate. 4. What is the mechanism of action of metformin, the most commonly prescribed oral agent for type 2 diabetes? A. Stimulates pancreatic beta cell insulin secretion. B. Decreases hepatic glucose production and improves insulin sensitivity. C. Inhibits carbohydrate absorption in the intestine. D. Promotes renal excretion of glucose. 5. In insulin therapy, what is the primary role of basal insulin? A. Covering carbohydrate intake at meals. B. Preventing overnight and between-meal hyperglycemia. C. Correcting acute episodes of hyperglycemia. D. Enhancing incretin hormone secretion. 6. Which of the following lifestyle interventions has the greatest impact on insulin sensitivity in type 2 diabetes? A. Low-protein diet. B. Resistance and aerobic exercise. C. Increased intake of vitamin supplements. D. High carbohydrate diet. 7. What is the correct sequence for teaching the problem-solving approach to diabetes self-management? A. Identify problem, generate solutions, implement, evaluate outcome. B. Generate solutions, evaluate outcome, identify problem, implement. C. Implement, identify problem, generate solutions, evaluate outcome. D. Evaluate outcome, implement, generate solutions, identify problem. 8. Which of the following is the most effective strategy for reducing the risk of diabetic foot ulcers? A. Increasing protein intake. E. Daily self-foot inspection and appropriate footwear. C. Intensive insulin therapy. D. Use of statins. 9. What is the primary benefit of continuous glucose monitoring (CGM) in diabetes management? A. Eliminates the need for insulin therapy. B. Provides real-time glucose trends and alerts for hypoglycemia. C. Diagnoses diabetes in asymptomatic patients. D. Reduces the need for HbA1c measurement. 10. A patient on insulin therapy has recurrent episodes of nocturnal hypoglycemia. What adjustment would be most appropriate? A. Increase basal insulin dose. B. Decrease basal insulin dose. C. Eliminate carbohydrate intake at bedtime. D. Add another dose of prandial insulin. 11. What is the ADA recommended target blood pressure for most patients with diabetes? A. Less than 120/70 millimeters of mercury. B. Less than 130/80 millimeters of mercury. C. Less than 140 divided by 90 millimeters of Hg. D. Greater than 150/90. 12. Which of the following best describes the dawn phenomenon? A. Hypoglycemia due to excess evening insulin. E. Morning hyperglycemia caused by nocturnal growth hormone secretion. C. Sudden hyperglycemia due to missed insulin dose. D. Postprandial hypoglycemia after high-carb breakfast. 13. Which of the following patients should be screened for type 2 diabetes earlier than age 35? A. Patient with BMI 22 and no risk factors. B. Patient with hypertension and BMI 32. C. Patient with controlled asthma. D. Patient with no family history of diabetes. 14. In motivational interviewing, what is the most effective communication strategy to encourage diabetes self-care? A. Giving direct orders to the patient. B. Using reflective listening and open-ended questions. C. Providing detailed written instructions only. E. Focusing solely on negative health outcomes. 15. Which of the following complications is most associated with long-term poor glycemic control in type 1 diabetes? A. Retinopathy. B. Asthma. C. Osteoporosis. D. Hypothyroidism. 16. What is the primary function of glucagon in glucose metabolism? A. Increases insulin secretion. B. Stimulates hepatic glucose production. C. Promotes glycogen storage. D. Inhibits lipolysis. 17. Which population is most likely to benefit from gestational diabetes screening at the first prenatal visit? A. Pregnant women under age 25 with normal BMI. B. Women with history of gestational diabetes or obesity. C. Women with no family history of diabetes. D. Women with normal blood pressure and BMI. 18. What is the recommended frequency of self-monitoring blood glucose, SMBG, for patients using intensive insulin therapy? A. Once daily. B. Twice daily. C. Before meals and at bedtime. D. Only when symptoms occur. 19. Which of the following dietary strategies is most effective for glycemic control? A. Eliminating all carbohydrates. B. Using carbohydrate counting to match insulin to intake. C. Eating 3 large meals per day without snacks. D. Following a high-fat ketogenic diet only. 20. Which of the following medications carries the greatest risk of hypoglycemia? A. DPP-4 inhibitors. B. Sulfonylureas. C. Metformin. D. SGLT2 inhibitors. 21. What is the primary reason for using a multidisciplinary team in diabetes management? A. To minimize patient involvement in care. B. To ensure comprehensive care addressing medical, nutritional, and psychosocial needs. C. To reduce the number of appointments. D. To eliminate the need for self-care education. 22. Which laboratory test is most appropriate for diagnosing type 2 diabetes? A. Fasting plasma glucose equals 126 milligrams per deciliter. B. LDL cholesterol equals 100 milligrams per deciliter. C. Hemoglobin equals 12 grams per deciliter. D. Triglycerides are less than 200 milligrams per deciliter. 23. Which of the following is a primary goal of medical nutrition therapy in diabetes? A. Achieve normal lipid profile, blood pressure, and blood glucose. B. Restrict all carbohydrates. C. Avoid all fats. D. Eliminate sodium intake. 24. What is the typical onset of action for rapid-acting insulin analogs? A. 5 to 15 minutes. B. 30 to 60 minutes. C. 1 to 2 hours. D. 2 to 4 hours. 25. A patient with type 2 diabetes presents with polyuria, polydipsia, and fatigue. Their blood glucose is 550 milligrams per deciliter, but ketones are absent. What is the most likely condition? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Addison's disease. 26. What is the most appropriate recommendation for physical activity in adults with diabetes? A. 150 minutes per week of moderate intensity aerobic activity. B. 60 minutes per week of light activity only. C. No exercise to avoid hypoglycemia. D. 15 minutes once a week of vigorous activity. 27. Which of the following best describes the role of incretin hormones in glucose regulation? A. Decrease insulin secretion and increase glucagon release. B. Increase insulin secretion and suppress glucagon release. C. Stimulate ketone production. D. Promote hepatic gluconeogenesis. 28. Which of the following is the most important consideration in insulin injection site rotation? A. Preventing lipohypertrophy. B. Reducing medication absorption. C. Improving insulin shelf life. D. Preventing local bruising only. 29. A patient with diabetes reports frequent episodes of hypoglycemia before lunch. What adjustment is most appropriate? A. Reduce morning rapid-acting insulin. B. Increase morning rapid-acting insulin. C. Skip breakfast. D. Add an extra dose of basal insulin. 30. Which of the following is a common sign of diabetic neuropathy? A. Tingling or numbness in extremities. B. Blurred vision. C. Increased thirst. D. Sudden weight gain.